In the United States alone, we have about 300,000 new cases of Lyme every year. So it really is epidemic. It is the fastest growing infectious disease in the world. No matter where you live in the United States, we've reported it in all 50 states. You're not necessarily immune from being exposed.
Welcome to the Healthy Skin Show with Jennifer Fugo, where we're flipping everything you've been told about your chronic skin issues upside down and connecting you with alternative solutions your dermatologist never told you about.
Welcome to episode number 56 of the Healthy Skin Show. Today, we are going to talk about Lyme disease and how Lyme disease can, for some people, be a hidden underlying trigger that can lurk underneath the surface, and you might have a lot of difficulty even getting a doctor to believe you, let alone run tests to find out if Lyme disease has been something that's really plagued your health for a long time. Before we dive into that, I first want to give a shout out to Stacy Haas, who left a really fantastic review of the Healthy Skin Show. She said, "Love this podcast. I've been following Jennifer for a while and love her honesty and knowledge. This podcast is so helpful and her guests are amazing. Thank you." Well, thank you so much, Stacy, for letting everybody know what you think about the show. And for those of you who haven't done so yet, remember, every single time that you go on and you either share this podcast with people that you know or those who are in groups who are seeking help and other ideas for what's going on, or you head on over and review and rate the podcast on your podcast platform of choice, you help other people make a decision about whether this show is worth it to tune into or not. That one little thing that you can do really does add up to something. I know for a lot of people, they go, well, if I leave some comment, who's really going to see that? And believe it or not, people do read those comments. So your help in sharing what you get from this show, even if it's just a particular episode that you loved, means a ton, and also could be the reason why somebody will give the show a chance and have this huge aha moment. So be a part of the movement, be active, be engaged, and share what you think if you haven't had a chance to do so yet. Now, before we dive into our episode today with Dr. Darren Ingles, I want to answer a listener's question. Danny, who is one of our listeners, emailed us a question. So feel free, if you ever want to just email us a question, you don't always have to do a recording of it if you don't feel like it. Danny asked, "I know you're big on supporting liver detox, but I heard you mention that milk thistle won't really help. I'm confused because I've heard a lot of people say that it's good to detox your liver. Can you explain this?" First off, I absolutely love this question because I'm kind of a nerd and I find liver detoxification very fascinating. So there's that. Now, if you haven't tuned into episode number 47, I would highly encourage you to go back and do that because that will explain to you the basics of phase 1 and phase 2 detoxification and why your liver is not like a sponge. It's not like a fish filter. It doesn't do the things that are oftentimes discussed in blogs written by people who don't fundamentally understand that there are biochemical reactions that take place in the quote unquote detoxification role that the liver plays, right? Because it doesn't just quote unquote detoxify things. It does other things as well, like manage blood sugar and whatnot, but we're not going to focus on that today. We're just going to focus on the liver detox piece. Now, here's the thing with milk thistle. Milk thistle can have some really amazing effects if you've got a whole lot of other health issues going on. Sometimes people will find this helpful when they've got elevated lipid panels or they've got a whole bunch of other issues and they just want to help support their liver to function better. However, that isn't quite the case with skin issues. Skin issues are a lot more complicated. And oftentimes, one of the missing first critical pieces is that the liver can't handle everything that it needs to for a couple of reasons. First of all, way too much is headed its way, so it gets overloaded and bogged down. And the second piece is that it doesn't have enough of the ingredients that it needs to handle what it really has to do in the first place. So you've got this double-edged sword, and ultimately, yes, we want to reduce the amount of materials that are headed its way, but at the same time, we also have to support the overload that's there. So that becomes the more critical piece, is supporting the overload so that your liver can do what it needs to do. We're not going to focus on phase 1 detox. Instead, we're just for the purposes of this conversation going to focus on phase 2 detox. Phase 2 can be broken down into 4 separate reactions that happen: sulfation, glycine conjugation, glutathione, and glucuronidation. Those 4 pathways are very important because milk thistle only has the capacity in regards to phase 2 detoxification to increase or help support the increase of glutathione. So in the glutathione pathway, we need glutathione in order to process whatever needs to go down that pathway. Well, you're only essentially supporting one of those 4 segments. So what happens to the rest of them? Now, do you see why it's not as effective? I mean, it can certainly be a support, but I found from clinical experience that most people taking milk thistle don't see improvements when they've got chronic skin issues. That in fact, they really need the full spectrum of support because all of the pathways to some degree are just being overloaded. And just in case you're thinking, but I'm supporting one of the 4, so doesn't that mean that it can take over some of the work of those other 3 pathways? Well, no. In fact, the things that go down each one of them are different and they're not interchangeable. So you can't just support one and assume that you're fine. You really have to support each of the phase 2 detox pathways in and of themselves. So that's why it's better, and I found clinically in my practice that by supporting all of the phase 2 detox pathways, you achieve better results where you can keep a person likely from flaring, especially as you move into a gut protocol or something like that, which can oftentimes trigger a flare. And yes, you guys have heard me talk about how many people have done those candida detoxes and ended up with huge problems, flaring their skin, and they couldn't get it to stop. And this is one reason why, because the liver gets bogged down and can't deal with whatever else is being sent its way. And then B, as you begin diving into the other root causes, because sometimes you can't address them all at the same time, it can be just way too much for your system to handle. Your liver is set up appropriately to be able to handle what else is headed its way. And if you want to listen a little bit more into the different root causes that can be driving skin rashes, because the liver issue is certainly a big piece, but there actually are 16 total, you can also head back and listen to episode number 53. All right, let's begin transitioning over to our interview today with Dr. Darren Ingles on Lyme disease and how that can impact your skin health journey. Hi, everyone, and welcome back. Today, I have the pleasure of introducing you to my friend, Dr. Darren Ingles. He is a respected leader in natural medicine with more than 28 years' experience in the healthcare field. He's board certified in Integrated Pediatrics and a fellow of the American Academy of Environmental Medicine. He has been published extensively and is the author of a fantastic book called The Lyme Solution, a 5-part plan to fight the inflammatory autoimmune response and beat Lyme disease. And this includes his comprehensive natural approach to treating Lyme disease. He specializes in Lyme disease, autism, and chronic immune dysfunction using diet, nutrients, herbs, homeopathy, and immunotherapy to help his patients achieve better health. Thank you so much for joining us, Dr. Ingles.
Oh, well, thanks for having me, Jennifer.
So, of course, since you have this amazing book, I thought you were the perfect person to talk about Lyme disease, which is considered a huge epidemic. And people might be thinking, oh, okay, so we're talking about like a bullet type rash today because it's the Healthy Skin Show. But the reason I actually wanted to talk to you is that Lyme can also be an underlying hidden reason that can also drive chronic health problems. So I think in many respects, from just the skin perspective, but also if we look more globally at what could be causing symptoms throughout the body, I think Lyme is a really great conversation to have. So could you tell us a little bit, for those people who might not be super familiar with how you end up with Lyme disease, they're thinking ticks, but
Right.
can we be a little more clear on what is Lyme disease and how do you get it?
Sure. Well, Lyme disease itself is actually a bacterial infection. So, people get sinus infections and ear infections. Well, this is just a different type of bacteria, although it's a little bit unique in that it's not something that you necessarily get from coughing on someone. This is something, again, we've typically associated with a tick bite. However, we've now learned that there are other ways to get Lyme. You can get them through mosquitoes, potentially fleas. We've now shown that it's passed potentially from mom to baby if mom has Lyme disease when she's pregnant. And some recent research came out finding it in the semen of men and the vaginal secretions of women. So now we have a big question mark about whether it might even be sexually transmitted. So, there's still a lot of question marks about different ways to get Lyme. But consider that in the United States alone, we have about 300,000 new cases of Lyme every year. So it really is epidemic. It is the fastest growing infectious disease in the world. And no matter where you live in the United States, we've reported it in all 50 states. You're not necessarily immune from being exposed. So, the one thing kind of coming back to your initial remarks that I think people need to keep in mind, when you start hearing about chronic neurological issues and joint issues, that combination always makes me very suspicious for Lyme because there's just very few things out there that overlap with both systems. So when people complain that they're tired all the time and they got brain fog and their joints hurt, something like that always raises a red flag for me that Lyme could be an underlying cause.
Well, you had also mentioned to me beforehand, because I think it'd be worthwhile to discuss what the rash itself looks like, because this may be helpful for people who are listening. You actually told me something I didn't know. So tell us a little bit about what a Lyme rash looks like and the fact that it can also change over time.
Right. Well, the classic rash for Lyme is what's called an erythema migrans is the technical name, or we call it a bullseye rash. And when you look at the rash, it literally looks like a bullseye or a target, where you sort of have alternating red, clearing. It can start as a very small rash, and then it tends to spread over the course of time. The one thing about this rash that's kind of unique is that it tends to be a flat rash. So as you rub your fingers over your skin, it doesn't feel raised. It doesn't tend to be itchy in most people, at least not initially. Usually the itch comes later, but it will spread over time. And I had Lyme disease myself. I had this rash. It started out about 3 inches initially, and by the time it got done spreading over the course of about 6 to 8 weeks, it was about 12 or 13 inches and then covered the entire back of my leg. So that flat spreading rash can be very indicative of Lyme. And we talk about that bullseye characteristic. However, there are a lot of variations of the Lyme rash, so they don't always necessarily look like a bullseye. I have seen patients that have just a flat red rash, but the thing is that it spreads. When you look at other, dermatological conditions, the lesions tend to be kind of consistent and not necessarily spreading. So when you see a flat spreading rash, it's not always Lyme, of course, but that would be, again, a red flag to investigate that a little bit further.
And that's a really great point to make, too. It's one of the things that I'm so paranoid, by the way, about Lyme, because I live in Pennsylvania, which I knew that there are a lot of cases of Lyme disease. I didn't know quite as many as you had shared with me before we started talking. And then my parents also have a home in the Chesapeake Bay, and we see lots of ticks around there. So I'm very paranoid about being careful and checking to make sure I don't have ticks on myself or they crawled under my clothes or anything. But, this is something that was constantly reiterated to me as I was going through my master's program and working on my clinical hours. We know that the skin issues can be a manifestation of other issues underneath. Right. And that's why I think it's important to have this conversation. And there's a lot of people that have gone for a long time with undiagnosed Lyme disease. And then, you might come to see somebody like myself or maybe see you, and all of a sudden you're being asked, hey, have you ever been checked for Lyme? And it might take the person back. Like, why would that matter? So is it possible that somebody could have Lyme disease underlying a lot of the symptoms, but it's like you didn't even think to look there in the first place?
Absolutely. We kind of laugh that, they call Lyme the great imitator, the great mimic. It looks like a lot of other things. And there's upwards of 100 different symptoms associated with Lyme, including a lot of, skin manifestations. So, Yeah, when you've got any kind of chronic illness, when you've gone to the doctor and you've done a litany of tests and everything keeps coming back negative, 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 again, it raises a red flag for me. And not just Lyme, but, even other infectious agents. Certainly from a tick bite, we know that you can get Lyme, but you can also get a lot of other types of infections, particularly bacterial infections, things like, Bartonella, Babesia, Anaplasma. Every time I go to a Lyme conference, it seems like we've learned about more things that you can get through these tick bites. So as a clinician, we have to really do our diligence to investigate all these different things, because any of them have the potential to start triggering, different types of inflammatory responses, which can affect really any organ system. So, you just have to, I think as a patient, if you've been having these ongoing chronic issues, you really have to work with your provider to do that investigative work and rule out all these underlying infections, including Lyme, as a possibility. And particularly for people who live in New England or the central Midwest, where Lyme is really epidemic, that should be on every doctor's radar.
And actually, I want to share the map from the CDC that we talked about before this interview. I'm going to put that in our show notes, because it was quite staggering for me to look at that, for all of you listening to this podcast, of where the confirmed cases are concentrated.
Yeah.
It was a little shocking. I didn't realize that the state, many of you know, I live in Philadelphia, the Philadelphia area, which is in Pennsylvania, and it's one of the top states for Lyme disease. And a lot of the states in New England have a high rate of cases. So it may be good to just kind of educate yourself. And if you know somebody as well who is having these type of issues, maybe this would be a great podcast to share with them. Now, for someone who suspects that Lyme disease could be an issue and they want to dig in that direction, I've had a lot of clients, they'll go to the doctors and they'll say, hey, can I get tested for Lyme? And they'll test like one thing. That's it. So what should you ask for? Or if we do have practitioners listening, what should we be looking for and testing for if we're really going to get an accurate yes or no answer as well if Lyme is present?
Yeah, unfortunately, it's really complicated in that, Lyme is, even if you go to the CDC's website, they tell you Lyme is a clinical diagnosis. What that means is that's really based on your symptoms. So the lab test is really confirming our suspicion. Unfortunately, lab testing for Lyme is not great. It's not a very sensitive test. If you go to the regular reference labs out there, we know that their test is less than 50% sensitive, which means it literally doesn't even pick up half the people that have the illness. I was a microbiologist before I was a doctor. I used to do this test for a living. That's a terrible test. If it's not even picking up half the people that have the illness, that's a bit of a problem. So I think, as a shortcut to getting well, if you're really concerned that this might be an issue, get in the hands of a provider who's knowledgeable on Lyme. Unfortunately, most conventional doctors out there are not either knowledgeable on Lyme or they're very dismissive of it and don't think it's a big deal. There are groups of doctors out there we call Lyme literate doctors, whether they're MD, ND, or nurse practitioner or whatever. So get in the hands of someone who really understands the testing, because there are labs out there that do offer better testing, that have a higher sensitivity and at least have a greater chance of picking up if you do actually have Lyme.
And I appreciate you saying that, because I've had people come to me and say, hey, can you help me? I think I have Lyme disease. And the first thing I will say to them is, no, I don't have experience with that. You really need to work with a practitioner. And so I want to be very clear, everybody. There are some things that we can do ourselves. We can be investigators of our health, and we can take the steering wheel in both hands and drive the cart forward. But Lyme disease is something that is very complicated, and you have to make sure whomever you work with really understands this, because it is complicated and it is beyond the scope of figuring it out at home from reading articles online.
Right. And
I just want to specify that.
Yeah, it's a very common scenario that people have this, again, these chronic symptoms. They go see their doctor. The doctor maybe does run the standard Lyme test. It comes back negative, and they say, well, you don't have Lyme, end of story. And we just know, again, that that's not a great test. That's not necessarily true. And I just see so many people that get shuttled off, then they're left with this mystery illness, and nobody ever digs a little bit deeper. So I think, again, unfortunately, a lot of healthcare providers are really not aware of how poor the testing is. They're also not aware that Lyme is a clinical diagnosis. So, if you've gone through and you've ruled out other autoimmune problems, other, infectious agents, and, you keep coming up empty-handed, again, it'd be worth getting in the hands of someone who's going to dig a little bit deeper with you and try and figure out what's going on.
And I will also add to that, I know a number of people who were diagnosed with chronic fatigue syndrome and fibromyalgia, and they actually had Lyme.
Yeah, that's a very, a lot of these diseases that we call sort of vague diagnoses, chronic fatigue, fibromyalgia, even MS, you can say, okay, it's a collection of symptoms, but why? If you ask your doctor why, they're going to shrug their shoulders. They have no idea why. I think, again, Lyme can be a cause, definitely not the only cause, but worth at least investigating. Again, I've seen a lot of people, again, with MS that, their neurologist says, well, you've got MS. Okay, why? I don't know. And yet we have tons of research on not just Lyme, but other infectious agents that can be a cause of MS, including Epstein-Barr virus. So, again, if you take just a little bit of time to do that investigative work, that might redirect your treatment and, start getting people better. So, again, it just takes a little bit of time and diligence to do that work. But, these are all tests that are commercially available. There's nothing magical about them. It's just, I think, working with the right lab that's going to give you the best information.
And so if somebody does have, if they've seen that bullseye rash, or they aren't sure, they're like, I may have gotten bit years ago, I'm a hunter, or my family lives in the woods or whatever, and they suspect this, but you've had it for a long time. Is this something you can actually get rid of? Like, what can you do to help yourself as far as Lyme is concerned? What should someone expect is going to happen?
Well, we know the earlier you start treatment, the better chance you have of getting it over faster. I mean, there's nothing, again, secret about that. So if you've been exposed 10, 20 years ago, I don't think it's something you can't necessarily overcome. I've had patients who, as far as we can tell, were exposed many years ago. The immune system's amazing. The body has a great capacity to heal. We just got to give it the right tools to do that. So again, I think it's really about getting in the hands of a practitioner who's knowledgeable on this. There are differing opinions on the best way to treat what we call chronic Lyme disease. Some doctors are very much in favor of using antibiotics. Someone like me, who's a naturopathic physician, is going to start leaning more towards botanical medicine. It's just different ways of trying to accomplish the same goal. So I think you have to find, what works for you, what your body tolerates. With chronic Lyme, I'm not as big of a fan of using antibiotics, in that we have quite a bit of research showing that it's not very effective when you've had it for a long time. Plus, I think, with antibiotics, we know that's going to start wiping out your normal microbiome in your gut, which we know is horribly important for immune function. Not to mention it can damage your mitochondria, which you need to make energy and thrive. So, we find with herbs, it's actually working in conjunction with the body without necessarily suppressing any innate capacity in your immune system or your gut. So again, it's just a different way to approach it. But fortunately, there's a lot of things that people can do in terms of managing their diet, using herbs, using other natural means to try and help facilitate, cellular repair and healing. It can take a while. I think realistically, 6 months to a year or sometimes longer is common. So it's not an overnight fix. But even if you had it for 20 years, there's no reason to believe that you can't get healthy again.
That's good to know. I like the idea of helping to manage people's expectations, because a lot of times you want to think, oh, well, I did this and in 4 weeks I should feel better. And I've noticed with friends who have been diagnosed or that the Lyme component was uncovered, that journey takes quite a while. And I think that that's an important thing for people to just have in the back of their head, that you have to be patient with this. You need to be consistent and you need to work with a practitioner. And if someone does have, let's just say they have skin issues and they've got a whole cluster of symptoms going on and they discover that Lyme is a problem, generally speaking, do you think that Lyme is the best place to start digging into the issues if you find that Lyme is a problem, a hidden root cause? I'm just kind of curious about your thoughts on where do you start?
Yeah, well, I think in my practice, because I see a lot of people that have had chronic issues. And so when we see any kind of chronic, whether it's chronic migraines, chronic joint pain, chronic muscle aches, again, most people have already been to their doctor. They've had a lot of tests run and everything's come up negative. So they've been left with really no explanation of why they feel the way they feel. So any kind of chronic lingering thing that hasn't been well explained, it's at least should be part of the evaluation. It certainly wouldn't be the only thing, but in my practice, I routinely just screen people because I found people that we find that they do have exposure, and Maybe the strangest case I ever saw, I had a woman who came in and her only complaint is that she had an area on her cheek about the size of a quarter that was numb and a little bit red. And you looked at it, it looked a little bit maybe like or eczema, some sort of, weird skin thing. And I tested her for Lyme. She was positive. We went ahead and treated her, and the numbness went away and her skin coloration completely returned to normal. And that was her only symptom. So, we get sometimes very odd manifestations of Lyme. We always think of the classic cases of, headache and fatigue and joint pain and swollen glands and more of the stereotypical acute Lyme disease presentation. Most of the people I see don't have that. They've got these odd variants. So again, when you start hearing about these chronic issues that haven't been well explained, it should at least be something you look into.
Okay. Well, thank you very much for sharing all of that with us. I love the fact that you're very realistic and practical, and you're trying your best to educate people on what this really means, because Lyme disease is a really hard thing to go through. And again, it's not something you can do yourself. You really do need support to walk down this path. And I agree with you 100%. It has to be a practitioner that has a lot of experience and training in all the different options, and they have a lot of experience dealing with Lyme disease. And you're located out in California.
Yes.
And you also have a great website, which has articles on it as well for everybody to check out, in addition to your book, The Lyme Solution, which we'll link in the show notes for everybody to easily find online and grab a copy of. But you also have, which I want to make sure I share, you've got a great free download. If you head on over to DarrenInglesND.com, you can actually sign up, and Dr. Ingles will send you his top 10 immune boosting recipes. And that way you can get a sense of what he recommends to his patients who are struggling in this area, and at least you can start to maybe try these out and see if you can help your immune system start feeling a little bit better and just in general feel better. But I want to thank you so much, Dr. Ingles, for joining us, and I look forward to having you back on the show some other time. I know we've got other skin issues that you'd love to talk about, and I'm excited to share them with everybody.
Great. Thanks so much, Jennifer.
I hope that you found this episode enlightening. It was honestly shocking to talk to Dr. Darin, because one of the big things you fail to realize is just how widespread Lyme disease is, and often how misdiagnosed or underdiagnosed it also is. And so we've got some great resources over on the post for today. If you head over to skinterrupt.com/056, you not only can find all of the resources that we've discussed and links to Dr. Darin's books and everything else, but we also have the show notes, and you can ask questions and share any thoughts on this particular episode so we can keep the conversation going. As always, if you haven't yet rated and reviewed the podcast, please do so. Subscribe and let friends know, because ultimately sharing is caring, and we help support one another in this community by sharing the things that we find insightful and valuable with others who are struggling and feel very stuck and limited in their choices. Thank you guys so much for tuning in, and I look forward to seeing you in the next episode.